Yesterday on the show, we were joined by aggrieved health practitioners representing a group of Indian and black practitioners in the sector alleging ill treatment by medical aid schemes based on the color of their skin and ethnicity. Clinical social worker Nomaefese Gatsheni and Dr Gumede, the chairperson of the National Healthcare Professionals Association, accused the likes of Discovery, Medscheme and GEMS of harassment and exploitation, withdrawing payments due to them. The response to the allegations, of course, are coming in, and in studio with us we've got Dr Jonathan Broomberg, who is the CEO of Discovery Health. Just to note that we extended an invitation to both Medscheme and GEMS to join in the conversation. However, they did not confirm their attendance. So we thank you very much for coming in to respond to some of these allegations.
Oh, it's great to be here. Thanks, Leah.
Well, let's get to the bottom of it. I mean, you
Sure.
heard the interview, you heard the allegations. What is your response?
I think just to make it very clear that nothing could be further from the truth than the allegations that were made yesterday. These issues have got absolutely nothing to do with race, and they've got everything to do with fraud and billing abuse, the abuse of claims submitted to medical schemes. So, yeah, and what I'd like to do is take a minute to explain to your viewers how their medical aid schemes work. Medical aid schemes are run as not-for-profit entities. They're owned by the members. So the premiums that members pay in every year have to be enough to cover the claims. And what happens in the case, for example, of Discovery, we receive about 200,000 claims every day, 200,000. We pay out automatically, so we have very sophisticated computer systems that process those claims. We pay to the member or the doctor within a couple of days, and we pay those claims 200 million rand a day on good faith. In other words, on good faith that the doctors, the health professionals, the hospitals that are submitting those claims are doing so honestly and in accordance with the law. And what we then do, just to make sure that that's the case, is we use very sophisticated statistical analysis, artificial intelligence, to identify any abnormal patterns. And when we do identify those, we investigate them. And that leads to some of the issues that you heard about yesterday.
Yeah, but I think what was concerning is when you look at the list of names,
Yes.
It appears that the majority of the names are of black health practitioners, Indian health practitioners, and perhaps, if we could fill one hand full, of white practitioners.
Well, firstly, let me say very clearly that list is not a Discovery list. It's a GEMS list as far as I
Which is
knew.
a fact.
We don't have a list of that kind.
You
of
don't
any
have a
kind.
list circulating?
We don't publish a list at all. We would never do that. We do have, from time to time, a group of practitioners which we have blocked from payment. Right now, cumulatively after many, many years, that lists at 367 people, 367,
Yeah.
and out of 35,000 billing practitioners. Okay, so every year, over 35,000 practitioners bill a Discovery Health medical scheme client. They bill us. 367 of those are blocked. And I can tell you that the blocking is an absolute last resort. It's a final measure taken after either repeated incidents of fraud or abuse, and usually after the practitioner has point blank refused to engage with us, because our approach is, please engage, show us some evidence, show us that you have done what you say you've done. If you have, no problem. If you haven't, then you owe the money back, and that money is members' money. Remember, fraud like this drives up premiums, and the people of this country are struggling with the high cost of medical aid. We all know this. We think fraud could account for up to 10% of all the claims every year. If you could get rid of that, after the last 10 years, premiums could be half of what they are today. So if we could deal with all of that fraud.
Okay, let's talk to some of the requests that you make to the practitioners.
Yes.
Some saying, and was alleged, that, which I saw the letter, and again, I can't say that it is from Discovery, because that letter was not from Discovery. But what is being said is that medical aids are asking the practitioners to divulge some of the confidentiality agreement that a doctor has with a patient, to give notes, to give lists of names, to give duration of these consultations that are taking place. Do you do the same? Do you require that?
So I think this is a very critical point. What you have is many situations situations where a practitioner says, I saw 15 patients on this day. I saw them each for 75 minutes. Please pay me the following amount as a result. We get those claims. We then see that a particular practitioner is a complete outlier relative to his or her peer group. In other words, they tend to be claiming much more. It's very legitimate to ask that practitioner, please can we see the appointment diary to confirm. Remember, we paid those claims to that person in good faith. And secondly, could you show us the notes? We don't need to see any confidential information. To be honest, that's a very poor excuse. We simply need to see people were seen and for how long they were seen. There's nothing confidential, Jan, in me learning, in discovery learning, that you were seen for X minutes versus Y minutes.
Yeah, but
we're not asking for a diagnosis.
But
or
if you're
any
asking for my notes, that's where I begin to worry.
But actually, I mean, the practitioners know we do not need, so that we ask them to bring in their notes, and we do not need any clinical or personal or private information. You surely know we would know better than to request that. We understand that information is confidential.
But you're saying you are requesting the notes?
No, we're requesting very specific information on the notes, which is prove that you saw the following patients because you submitted claims. Now remember, there's a proportion of dishonest practitioners out there, very small, but who submit claims for people they've never seen. So we've got a right to say, prove to us that you saw Mrs. A or Mrs. B, and prove to us that you saw him or her for 75 minutes or 50 minutes, whatever you claim for. That's all we're asking for, to be very clear.
Okay. What about the fee structure? Because there's also the note included to these practitioners to say, we have noted that you charge more than one of your fellow practitioners.
Right.
And then they go on to say, or what was alleged in the interview yesterday, is that when they ask and say, okay, well, can you please tell me who the other fellow practitioners are? There's no evidence ever supplied from you, the medical aid, to the practitioner, and they just sort of almost are set up for failure.
Yeah. So I think the point I would make here is that what we're saying is the cost of your consultation, which is a function of both the fee and how long it is higher than average. And, we would be very happy to show any doctor on average, we'd show them the graph, which says, here's what the distribution looks like. The average person charges, a total of, I'm making up a number, 300 Rand per visit. Yours are at 395. And we could show them the graph. We're obviously not going to show them Dr. A, Dr. B, Dr. C, because that's also confidential. But there is no problem demonstrating to the person who was on the show yesterday, where she lies relative to her peers whatsoever. We're happy to be totally transparent with that information to her.
Which they allege you're not.
Yeah, but we are.
And that's a problem, is to find that middle ground between the two of you to say, look, the other thing that was said is that a lot of health practitioners are taking their lives because medical aids are not paying for them. You study years and years and years, and we know that there are people out there that will try and beat any system. I mean, I just had an interview with the IEC where I'm saying, you cannot believe that everybody is going to go in there with the right intentions, because unfortunately there are people there that are out to defraud systems. But there are also people out there that are doing the right things. They've studied really hard, they have a business, and the medical aids are not paying them.
No, that's not true.
And they're taking their own lives.
That could not be further from the truth. So remember, I said there are 35,000 practitioners billing us every year. We pay those people instantly. Over 90% of them are paid, and in fact, as I said, 1.6% of them are blocked. Okay, so 98.4% of the practitioners in this country get paid by us immediately that we receive the claim. So that's very important. Of the 35,000, we investigate just under 10% a year. 3,500 are investigated every year for either fraud or abuse, and about 82% of those we find clear, hard evidence. And when we do that, our instinct and our processes are very clear. We engage. We say, please come and see us. Bring representatives, if you like, lawyers or other professional representatives. Show us the data. We do that over and over again, and the vast majority of those cases are happily resolved. Money gets paid back. We continue paying the practice. 1.6% are people who have either repeatedly committed these acts of fraud or point blank refuse to engage with us. Those are the people that we then say, look, this is members' money. We are not going to keep paying a practice that's either repeatedly committing fraud or that refuses to supply us information to prove otherwise. I think that is perfectly legitimate, and as a medical aid member, I think you would expect nothing less of us in being the guardians of your money. That if people are trying to steal money from you and the rest of the medical aids, we must ensure that that doesn't happen.
I want to play this clip now from yesterday because, you know, I'm speaking to what was said, but let's listen to this clip and perhaps get a response from you on it.
You get the letters that are inviting you to say you are due for review. And you start, and they will note that what is needed. They will tell you first that your tariff codes are high, you are a risk to the medical aid scheme, you charge more than your peers, so bring the following. Bring the clinical notes, bring the diaries where you were seeing patients, bring the files of the patients. Now this is where the problem begins, because ethically so, how do I disclose the information, private information of the patient?
Yeah,
to a third party.
Indeed.
Now, I've got three problems with that. One, why am I getting audited, especially with confidential information of the patient? Two, why are these audits, the manner in which these audits are done, why is it targeted to blacks and Indians? And I'm not saying white people are not audited. Definitely they are, but very few percentage of them, because you don't hear anything about white. In the list, you don't get even the white
One
people.
single name.
No,
So there's not a single
person.
name of any
Yes.
white doctor on that list.
Yes. So now you start to question, why is it only blacks, and why audits in confidentiality of the patients? Two, why are you audited without a contract? Remember, if you say you're going to audit the health practitioners, you should give us first the contract. When we sign, you should make us sign something. Give us a contract that you will be audited.
All right. That's just a clip from the interview yesterday, and I know you've seen it. But, you know, you said out of all of the practitioners that are operating, I think you said the number 367 is the number that you guys have investigated and you say are you know, they can't be paid by Discovery. Are they blacks? Are they Indians?
I have no idea, Leanne. We have never applied the criteria of race or gender. We never would. I have no idea. What happens, as I said,
could you supply us with that list, though?
I don't think we would. I think we would regard it as confidential information between us and that practitioner. And by the way, that list, once you're on that list, you can come off that list at any time. Simply come and talk to us, you know, and try and resolve the issue. Usually, what's happened is the practitioner has point blank refused to engage, and then you leave us no choice. But we have no idea about the race. As I said, just consider the volume of claims. You know, it's 200,000 claims a day. It's machines that are doing this. They identify the risks, and our investigators then call in and meet with people. And you know, 3,500 of these investigations a year. The vast majority, over 99%, satisfactorily resolved in one way or another. The last number, the 1.5%, and this is cumulative over all the years, are people who just are not cooperating or repeatedly defrauding the medical scheme.
Yeah. You know, the difficulty in all of this is that medical aids have got a reputation of being bullies. You bully your member to go to certain doctors. You bully your members to buy and only have and pay for certain medication and not the rest of it. Hospitals are complaining. I mean, Netcare just released their results. The front page of the Business Day is talking to how it's the medical aids that are also contributing to their downfall in profits as well. So it just appears that medical aids have got a reputation of being bullies, and this wouldn't surprise anybody if, in fact, these lists are circulating.
So, you know, all I can say is that, you know, the medical aid at the end of the day is owned by you and all the other members.
Certainly not owned by me.
Yeah,
I mean, my medical aid ran out in January.
Yeah,
That's how bad it is.
But your day-to-day savings accounts may have.
That ran out too, and I'm on Discovery.
But you're a member,
But that's the problem, is that half of us are paying, and are we really seeing the benefits of being part of a medical aid?
The Discovery Health Medical Scheme collects close to 60 billion rand a year of claims, and pays out every one of those rands, so very close to 60 billion rands a year of claims. all of us, you included, many other people, feel that these premiums are very expensive. What we are trying to do here is look after your money as best we can to make sure that when there's a 6 million rand claim for a premature baby, when a person's in ICU for 6 months and has to claim 4 million rand, those amounts are paid, no questions asked. When, heaven forbid, somebody has a terrible car accident, those are paid. The way the medical aid works is the young and healthy, and you are young and healthy, Leanne, tend to pay more than you claim. But that is because there will come a time in your life, in your family's life, when unfortunately you may end up claiming 10,000 years worth of premiums. That's the way it works. The healthy and the young are subsidizing the older and the sick. That system can only work if we guard that money very carefully. It's very unfortunate that in doing that, we are perceived as bullies. But we can't make everybody happy. We can't keep premiums low. Let fraudulent doctors keep the money they're stealing. Let hospitals make huge profits. And let everybody do whatever they like. Otherwise, premiums would be double or triple what they are today.
So 2 quick fire questions at you. Is Discovery racist?
Absolutely not, Leanne. As I said, I have no idea who the doctors are that are investigated, and we don't know the race of those people. We're completely indifferent to that. Our analytic systems pick up the fraud, and we then investigate it.
Would you welcome a commission of inquiry into these medical aid scams and into something like this?
We'd welcome any investigation, but let me say first, these issues have been tested repeatedly in the courts of our country, and we have repeatedly prevailed in those court actions. Over and over again, the courts have defended. This is in legislation. Medical schemes, by law, are entitled to recover monies that have been fraudulently stolen from members of the medical schemes.
All right, we're going to leave it there, but we do thank you. We thank you for coming in and talking to us, and we do hope that we can get the same from GEMS and Medscheme, who have also been fingered in this. That was the response from Discovery Health. That was its CEO, Dr Jonathan Broomberg, responding to allegations made by a group of health practitioners accusing them of discrimination. We'll see you after this.